Sangamam has been all about getting people together, having these entertainment shows, making people happy. But we started with something which adds a lot more value to Sangamam. Something that could give back to the community. Something about incorporating a good message that could benefit everyone in our community. And I guess most of you would know what I'm referring to. We had done a CPR initiative last year to bring around the awareness of CPR. Many of you who are sitting here might have taken the certification. It was very successful. We had over 200 people who took their CPR certification courses from the Pinnacle Health hospitals, and that happened through Sangamam. Can we have a big round of applause for everyone who had helped us with that initiative the first time around? So that being said, so once we start a good thing, we have to keep it going, right? Right? Isn't that what our parents and our elders have told? You start something good, you just keep going at it. So we want to keep up with getting forth this good social message through a platform like Sangamam. And here we are trying to talk about yet another issue, which is very pivotally important to a lot of us, especially in the Asian community. I know you guys all would have known now that we're going to talk about diabetes. You're all very sweet people, but nobody wants to have high blood sugar levels. Do you? Do you guys want to have high blood sugar levels? So here we are trying to give you this message, and I have immense pleasure in welcoming Dr. Madhu Menon, who is the current president of SMA. He has been a physician member in this community, a very wonderful human being. He has put in a lot of effort into bringing this presentation forth to you guys, which is going to talk a lot about what is diabetes, and he's going to walk you through it. Just to give a little brief about him itself, he did his MBBS from Gandhi Medical College, Osmania University, FRCS from Royal College of Surgeons, England, and he's a board certified primary care physician working for the Pinnacle Health organization here. So we have immense pleasure in welcoming Dr. Madhu Menon to talk to you guys about diabetes and how you can help yourselves and avoid from getting into a tough spot with this disease. Can I have a big round of applause for Dr. Madhu Menon?
Thank you. Thank you, Pavi. What I'm going to talk today is something that very few of at least my patients, when I talk to my people back in India, know, and that is, can we stop diabetes? You know, everyone, I know there are a lot of people in the audience who have diabetes, but the thing is, now we know for sure that we can stop diabetes. Now, how do we do that? I mean, it's not that easy as, getting a test and popping a pill and saying, okay, my sugar is fine, my hemoglobin A1C is fine. Can I have the next slide, please? Can you dim the slide side so that everybody will see? Yeah, that's fine. That's fine. So why the emphasis on stopping diabetes? Why should we be stopping diabetes? What's the problem? Most of the people think, oh, diabetes, that's fine. It's my high sugar is high. I can take a pill. I will be fine. Everything is going to be hunky-dory. But that's not the truth. Can I have the next slide, please? So this is what's the fact. Globally, in the world, we have, at the moment, and 371 million, I'm talking about million diabetics in the world, and this is increasing. The sad thing is that among this 371 million, 50% do not know they have diabetes. 50%. So every alternate person do not even know they have diabetes. And this is not just in one country, this is worldwide. You take any country, nearly 1 of 2 who have diabetes don't even know. So the question is, if you don't know, how can you prevent it? And again, of this 371, well, now I'm talking to an Indian audience, an Asian audience, people who are from Southeast Asia, 70 million are in India. So just imagine 371, 70 million, and there are only 26 million in the US, and that itself is a big figure. Every fourth diabetes, the rest of it you can read, it kills more Americans than breast cancer and AIDS put together. Did anyone know that? No, diabetes kills more people. People talk about breast cancer. People talk about prevention of breast cancer. Everybody goes and has a mammogram. But diabetes and AIDS, diabetes kills more people than those two put together. And every fourth diabetic in the world is an Indian. So that's the magnitude of the problem. And that's why everybody is now thinking, what can we do about it? Every fourth person is an Indian. And Asian countries, which includes the entire Southeast Asia, Pakistan, Nepal, Bangladesh, and Sri Lanka, they contribute to about 60% of diabetes in the whole world. 60%. 6 out of 10 people are from this thing. Now you may ask, why? What am I doing wrong? Well, we'll go through that. Can I have the next slide, please? So this is the world population, the world prevalence. Now if you see again, 371 million, of which 38 million are in the North America. Now, this includes US, Canada, and all of those things. But even in the US, if you see, 29% are undiagnosed. Almost one third are undiagnosed. They don't know that they have diabetes. In India, if you see, that number in India is 70 million. So you can imagine 70 million people, of which nearly 51%, as I told you, half of them don't know they have diabetes. So they are walking around happily without any symptoms, and then they all have diabetes. Next slide, please. Now, this is the incidence or prevalence of it. Now, anything that is, if you see the colors that are yellow, that's the lowest, and anything that is dark brown is the highest. And the ones that are in gray are the places where we don't have any data. So most of the African countries, we don't have any right data. The good thing is that India has a good amount of data, and there's a lot of work going on in India. And India is almost in par with the Western world. If you see, compared to US, Canada, Australia, South Africa, and South America, some of the countries, it's in par with them. So at least we are good in one field. Next slide, please. Now, this is kind of the CDC data. And the top number shows the prevalence or the increase in obesity in US. This is a CDC data, and the bottom one shows the corresponding increase in diabetes. So if you see in 1994, most of the states had less than 14% obesity and less than 4.5% diabetes. Now, the same thing in 2010, you can see, I don't have to explain to that, it's like wildfire. And this is the problem we have. Even here, in my practice, every day I treat like the first 10 patients of the day are diabetes. Next slide. What about Indians? We are all Indians. Most of us are of Indian origin, either Indians or Indian origin. They have done epidemiological studies in India, and they have shown that there is a significant escalation in diabetic population in India, which was 30 million in 2000, and right now it is 65 million, so it's doubled. And then they predict that in 2025, at the rate at which it is going, it will become 75 million. Why? There are multiple factors. Because of a high genetic predisposition, and also because of lifestyle changes. This is applicable to all Indians, not only just Indians who are in India, but every Indian who has come out of India, and every Indian who has has that same genetic pool. It applies to advanced countries or like US, UK, the European Union, and South Africa. And also, the other fact is that weight for weight, Indians develop diabetes at an earlier weight. So your BMI only has to be 25 to 30 compared to Caucasians and the local people who need at least 30 to 35 BMI to become a diabetic. So if you say 25 is fine, my weight is fine, I don't think I have diabetes, think again. Next slide. So what are you going to learn today? Now, this is not a lecture on diabetes, but I have to give you a little bit of perspective, putting it in the right perspective. So next slide, please. So diabetes is where the body does not make insulin, or you have plenty of insulin, it doesn't work. And that's type 2. So there is Insulin is made in the pancreas, we all know that, and it helps take the glucose from your gut, from the blood, and put it into cells. So cell is where you need energy, and glucose is the only energy source. So you could be eating a lot of, food, it gets converted to sugar, sugar gets into the blood, but it stays there. So it's like, famine in the midst of plenty. There's a lot of sugar, but it's all in the wrong place. Now, it should get into the cell for you to get energy, and that's why majority of the diabetics say, I feel tired, I don't feel good. Because if I have all this sugar, I should be feeling good, but you don't, because it's in the wrong place. Next slide. So if you see this is all about, how your food is digested, how it gets into the different parts of your body, and how it's defective. Next slide. So let's see, there are some myths, and there are some beliefs, and there are some things that every one of us believe, and I used to believe that too when I was in medical school. So let's go through this list. People think diabetes is not a serious disease. What's the problem? It's sugar. I'll take pills. I'll be fine. When I eat more, I take an extra pill. When I eat less, I don't take a pill. And I will be fine. There won't be any problem. Then people think it doesn't run in my family. My father doesn't have diabetes. My mother doesn't have diabetes. My brothers don't. So I'm spared. The third myth is eating too much sugar can cause diabetes. People think, I don't like sweets. I'm not a sweet person. I don't eat sweets. So forget it. I'm not going to get diabetes. And also, there is a common myth that, you have diabetes, so you will get the flu, or you have diabetes, so you will get illness. That again is not true. When you get the illness, you don't heal well. But it doesn't mean that you're more prone to any illness, anything in the world. Latest data do show, this is 2014, that diabetics are prone to certain cancers. It's straight off the horse's mouth. And we now know that certain cancers you are more prone if you have diabetes. Also, that diabetes cannot eat candy, cannot eat chocolate, cannot eat jalebis, cannot eat laddus. All that is wrong. The last thing is diabetes cannot perform certain jobs, like driving, for example, missionary. You cannot do night shifts. Next slide. So, suffice it to say that all of these are false. None of this is true. Why am I saying this? Well, you don't have to be despondent that, you have diabetes. You can still lead a normal life. You can still do your work. But our aim is not to get there. Because once you have diabetes, it's already too late. The horse is already gone out of the barn. Our aim today, in this era, is to prevent it. So you are either not a diabetic or a diabetic. And once you're a diabetic, you're always a diabetic. There is no time where you can say, I'm cured because of the medicines I took. It never happens. One time or the other, it comes back to bite you. Next slide. So there are two types of diabetes, type 1, type 2. Now, why is it called type 1 and type 2? Previously, it used to be called juvenile diabetes and adult onset diabetes. And the reason is, you can get juvenile diabetes or you can get type 1, which is previously called juvenile, in older ages. And you can get type 2 in younger ages. In fact, there are a lot of people who treat the pediatricians in the audience. If anybody treats children, you know that I've seen patients who are as young as 10 who have type 2 diabetes. And all this is related to lifestyle and body weight. So we have two types, type 1 and type 2. Next slide. There is also another type called gestational diabetes, and this happens when you're pregnant. So if you're pregnancy, if you see your obstetrician always checks your sugar regularly, they do a glucose tolerance test, which is it's called a glucola test. And what you do is you drink a certain amount of glucose, and then you measure your sugars 1 hour, 2 hours. And that's mainly because, now why am I touching on this? Because that's one of the risk factors for you to have diabetes later on. Next slide. Symptoms, usually, this is more applicable to the people who don't see a doctor, but majority of us, if you go to your doctor for a physical, or if you do blood tests for some reason, you go to an emergency room, they always do your sugar. So these symptoms apply mainly to people who never have seen a physician. Most of the symptoms are the same in both type 2 and type 1. Now, except that in type 2, you may have some symptoms which you don't attribute to diabetes. Next slide. So how do we diagnose diabetes? It's very simple, just a blood test. Now, you have to be fasting to get a blood test, and there is blood sugar that is done. There are also other approved tests, which includes a glucose tolerance, where you take some glucose, a certain amount of glucose, and then check your sugar. And also you have what's called the hemoglobin A1C, which is the extra sugar that gets into your red blood cell and gets attached to the hemoglobin. And so the higher the hemoglobin A1C, the greater your average sugars were. And these are the three types. You can see, I don't want to explain that, you have normal levels, pre-diabetes, and diabetes. Now, we'll touch upon pre-diabetes in a minute, but right now concentrate on what is diabetes. People often think your sugar has to be like 140 and 150 and 200. No, that's wrong. 126 milligrams per deciliter after 8 hours of fasting. If you are 126, period, you have diabetes. Or if you have a random sugar or 2-hour postprandial of 200, or a hemoglobin A1C of 6.5 or higher. Next slide. The complications, now everyone who's a diabetic in this audience knows. We ask you to get an eye exam, we check your feet, we check your urine, we check your kidneys, we check your liver. So these are the common complications. And if you see here, every specialty in medicine treats patients with diabetes or consequences of diabetes. There is not a single, you tell me one specialty in medicine, probably except the psychiatrists, but even then they see patients because some of the medicines raise the blood sugars. So they are also aware that, I should not be using medicines in a diabetic that will raise the blood sugar. So every specialty in medicine is directly or indirectly involved in care of diabetes. Next slide. Smoking. Now, this is something preventable. You don't have to smoke, but you do smoke. You get addicted early in your life. If you're a smoker and diabetes, that doubles your chances. You have a higher risk of complications of diabetes, and for that matter, any disease. Next slide. So what are the risks? How do you know? How am I going to know if I'm at risk? So these are the common risk factors for diabetes and pre-diabetes. So if you're 45 and above, now 45 and above is changing now. Now even as I told you, younger kids, as long as they have the second factor, that is overweight or obese. So 45 is usually if you are perfect. Even though you are perfect as far as your weight is concerned, and you don't have any of these things, just the fact that you are 45 makes you more prone, you get a risk factor, you're at risk. The other ones are, if you are overweight, if you have a family history, that's what your mother, father, and siblings. If you're of a certain ethnic group, and if you see in that we Indians or we Southeast Asians, we fall into that group. And then if you have gestational diabetes, that means you were given birth to a child more than 9 pounds. If you have high blood pressure, if you have low good cholesterol or HDL, or if you have high triglycerides, and you get that, you think, it's amazing how many Indians have high triglycerides and low HDL. And they tell me, what shall I do? I said, look out for diabetes, because this is the most important marker of diabetes, even though your weight is perfect, because that means that you are inactive. Now remember, I'm not talking about exercise. I'm just talking about physical inactivity. Not exercise. You don't have to exercise, but you have to be physically active. Whatever you do, be physically active. And that's more important. Nowadays, we're changing the paradigm, and we don't talk about exercise as much as physical activity. Next slide. So this is called an ADA risk test. Now, I have forms in the back. There's a table, not attended, because it's not a sponsored thing. There is a risk. This form is actually there. And also, there is a QR code in your brochure. If you look at your brochure on the page on diabetes, there is a QR code. You can scan that, and it will take you to a site where you can put in all your details and see what is my risk. So the paper things, if you need the papers, they're outside in the lobby. Or you can just take the brochure home, or you can even go to the ADA, the American Diabetic Association site, and figure out what is your chances. And don't have sleepless nights, because if you do it today, it'll be surprising where you are. And this is what I want you to do. My aim is to make you aware of the enormity of the situation we have. Next slide. So let's talk about prediabetes. Now, what is prediabetes? Have you ever heard the word prediabetes? Has your doctor ever told you you are a pre-diabetic? It occurs before diabetes, before you have diabetes. It's the stage between normalcy and diabetes. So you're not a diabetic, you're not normal either. And that stage is called the pre-diabetes. Your glucose is higher than normal, but not to a stage where you can say, you're diabetes. So commonly, we doctors, what we say is, your sugar is a little high, you should be careful, don't eat those carbs, don't do this, don't. Okay, they walk out of the office and that's it. Next time you see them is like in 3 to 6 months, and same thing goes on and on and on, till one day we tell them, listen, now you're a diabetic. Oh my God, no, I don't think so. Yeah, you are. So anyway, majority of the people, and the reason is because majority of them have no symptoms. You're not walking around with a headache. You're not walking around feeling fatigued. You're not walking around with any rash. You don't have any symptoms. You're leading your normal life. Next slide. So what is prediabetes? We doctors, we also call it the impaired glucose tolerance, or we also call it the impaired fasting glucose, IFG and IGT. So if any of you hear the term, it's the same as prediabetes because we don't want to scare people. So we just say, you have impaired glucose tolerance, or you have impaired fasting glucose. In 2012, this is 2 years ago, 86 million adult Americans had prediabetes. 86 million. These are people who don't know. And that number was up from 279 million in 2010. India, we don't have very good numbers because, again, we don't have something like, you go to your doctor and get a blood test very often. So we don't have a very good data, but roughly we think it is somewhere in this thing of 100 to 140 million. So remember, 70 million diabetics, 140 pre-diabetes. Most people don't have any symptoms. Some may have some complications. Now, once a neurologist told me, hey, are you sure they don't have diabetes? I said, I'm sure, because I do tests. She's not. This patient of mine had peripheral neuropathy. And I said, she must be joking. How can she have? She doesn't have, but I've seen. Lo and behold, in 5 years, she became a diabetic. And I was kind of taken aback that what she told 5 years ago was right. That you can have complications of diabetes even before you get diabetes. Isn't that amazing? I mean, you get complications after you get a disease. How can you get complications without getting a disease? And that kind of is mind-boggling. And majority of the people, if not treated, will progress to have diabetes, to become a diabetic. Next slide. So why do we have to stop this? It's because of this. The amazing numbers of 86 millions and climbing, 1.9 million new cases every year in this country. We diagnose diabetes, and it affects everyone in the family. Next slide. The current trend continues. Every ethnic population will 1 in 3 US and 1 in 2 Indians and the other ethnic population will develop diabetes in their lifetime. This is an amazing fact. 1 in 2. That means 50% of this population, the people sitting in this room, will develop diabetes. And isn't that amazing? So next slide. The other reason is the cost. Diabetes is an expensive disease to treat. US, and this is 2012. The data here is 2012. It costs the US $245 billion, not million, $1 billion, treating, that's the direct, of which 176 million is the direct cost, and 69 billion is cost because of reduced productivity. This number has doubled, which is like 41% more compared to 5 years ago, compared to 2007. So in 5 years, it's become like 41% more. And that is the magnitude of the problem. 1 out of $10 spent is for diabetes, and 1 out of every $5 spent is devoted to caring for people with diabetes, which includes some multiple other complications. Next slide. So what can we do about it? Okay, we said all these things. I've told you all these things. Now you say, okay, what is it I can do? Till recently, we did not have good data to tell patients what to do. We used to randomly say, do this and do that, and go and, reduce your weight, try to exercise, try to do this, try to eat well. All those things only happen in the consulting room. You go out, my patients straight go to the McDonald's. They listen to me, and next time you see their car is parked at the nearest McDonald's, and you say, why did I even say all these things? Next slide. So there was a study by CDC. This was funded by CDC in a multi-center trial, and it's called the Diabetes Prevention Program. And I've listed the thing. It went into seeing what can we do for pre-diabetic, and all these patients are pre-diabetic. So can we do anything to stop this nonsense? How are we going to stop it? So they did this trial called the Diabetes Prevention Program, and they found that participants who lost a modest amount, we're not saying lose, become half your size, a modest amount did stop pre-diabetic from becoming a diabetic. Next slide. So this is the conclusions of this study. And this is a CDC-sponsored study. This is not done by a drug company. So if you lose a moderate amount of lead, we are talking about 7%. We're not talking about 50%. We're not saying go half your size. We're saying 7% weight loss and 150 minutes a week, which is like 30 minutes 5 times a day. Not exercising on the treadmill, not going and joining a place where you have to go on the treadmill and go on exercise. This is just physical activity. Do something. Make sure your physical activity is more. And the common things I tell my patients is, park at the last thing in the grocery store. Don't park closest. We all have a tendency to park closest to the grocery store. Have a buddy. If you're working in a multi-story building, have a buddy and say, I will come up once, you come down once. And that's enough. You've done your exercise because you are physically active. Do yard work. Don't have the tractor, driven mowers. Do a push mower, and that's enough. So 7% and 150 is thing, and of course added to that is healthy diet and healthy lifestyle. That doesn't have to be constant dietary control. Next slide. So they have shown that reduces the thing by 58%. I don't know. Can you go back to the last slide? 58% of pre-diabetes, people who have pre-diabetes can stop becoming a diabetic. That's almost half the number, more than half the number. So what can we do? Again, as I said before, the recommendation from the ADA is to have more physical activity, more fibers. Forget about the fad diets. There are lots of those in the market. You're just wasting your money. You don't have to do that. Lose at least 7% of your body weight. And if you have a risk, go and get tested. It's very simple. Fasting sugar just is about $20, not more than that. You spend more in a restaurant. Next slide. And for those of us who are from India, and if you have relatives in India who have diabetes, there are 2 programs that are in India that are doing an excellent job in finding these people. One is called the Kadam, which is Knowledge-Based Actions for Diabetes Awareness Movement. It's basically letting people move, keep moving. Have you seen most of us Indians don't even move in India? We sit still. We don't even move. We don't even go to catch this thing. And it's getting worse because everybody has a car now. Everybody has a motorized vehicle now. You don't want to go anywhere. Everything is coming. The food is becoming refined. And all those things are putting us things. So this Kadam. And the second one is called the IDEA, which is Intensive Diabetes Education and Awareness. And this is where social workers and different people go to houses and tell them what to do, not only to stop diabetes, but also to stop heart disease. Next slide. And every year on 14th of November, we celebrate or we consider that as the World Diabetes Day. So it's coming soon, 14th of November. We have different programs, there are different things. Now, 14th of November is the day that Banting and Best found insulin. And that's the day we consider as the World Diabetes Day. So I think I don't want to go any further. Next slide. So thank you. And if there is any questions, I'm available outside through the program. Just let me know. And thank you for your attention.
I'm from Taj Palace, which is a gateway to authentic Indian cuisine. We are located on 3501 Paxton Street on the second level in the food court of the Harrisburg Mall. We can cater for any occasion, big or small. We specialize in North Indian, South Indian, and Gujarati dishes. A couple things on our menu are gobi manchurian, paneer tikka masala, and chili chicken. But our most liked thing on our menu is biryani. Taj Palace is open 7 days a week from Monday to Saturday, 11 a.m. and to 9 p.m. On Sundays, we're open from 12 noon to 6 p.m. Taj caters every day of the year. I hope you can order or visit soon.
Hi, my name is Atreya Sinderi. I'm a realtor with Coldwell Banker Select Professionals in Camp Hill, Pennsylvania. I've been serving our clients for the past 8 years successfully. You can reach me directly at 717-395-7675, or you can always find a lot of information about me and properties at www.atreyasinderi.com.